Both sides are dug in as thousands of federal workers worry about whether they'll have a job after this standoff. But tonight, we're going to have a real debate about the real issues that are at the center of all of this. The one in which Republicans claim the Democrats are demanding government-subsidized health care for undocumented immigrants. Now, there is a lot of nuance here, so stay with me. Follow me here. Big picture, their claim isn't true. The Democratic proposal does not explicitly and directly provide free health care for anyone here illegally. According to healthcare.gov, undocumented immigrants can't get marketplace health care coverage, and they're also ineligible for other federal programs like Medicaid and Medicare and CHIP. And the Democrat plan does not suddenly make them eligible. So here's what Dems are proposing. First, they want to preserve certain Obamacare subsidies so that millions of Americans can afford health care. Those credits are set to expire at the end of the year, and if they're not extended, premiums could skyrocket by more than 75% on average. And here is the point of contention. Democrats also want to reverse recent Medicaid cuts and other provisions that were enacted under Trump's big, beautiful bill. Republicans are saying that's going to give illegal immigrants free health care. Democrats do want to undo portions of Trump's bill that narrowed the subsidy of eligibility for certain immigrants with legal status like refugees, asylum seekers, and people with pending or approved visa applications. That's according to the Kaiser Family Foundation. But those are non-citizens, but they're not illegal aliens. That's a key point. Republicans also say the Democrats want to undo their attempt to close what they're calling a loophole. They argue that some states are using federal matching funds to pay for Medicaid costs, which allows them to use state funds to pay for care for the undocumented. All right. But here's the other key argument that Republicans are making. And it's that Medicaid may help reimburse hospitals for providing care to undocumented immigrants. Listen to the vice president talk about this.
If you're an American citizen, you've been to a hospital in the last few years, you probably noticed that wait times are especially large, and very often somebody who's there in the emergency room waiting is an illegal alien, very often a person who can't even speak English. Why do those people get health care benefits at hospitals paid for by American citizens? The answer is a decision made by the Biden administration that the Trump administration, working with congressional Republicans, undid. We turned off that money spigot to health care funding for illegal aliens. The Democrats, in their legislative text, want to turn it back on.
Now, for starters, that is a different issue from the subsidies for insurance coverage that, again, does not go to illegal immigrants. But more importantly, hospitals providing care to anyone in their waiting room, regardless of their immigration status, is not because of a decision made by the Biden administration. That's been the law since 1986, when, checks notes, Ronald Reagan was president. So is Vance arguing here that hospital funds should be contingent on whether or not they refuse life-saving care to illegal immigrants? Is that really the argument? To change that, they would need to do more than just tinker with the federal funding scheme. They need to actually change that law that is almost 30 years old, the one that's there to protect all Americans, insured or uninsured. And now Republicans are also correct to point out that many Democrats, including the party's heavyweights, have in the past called for care for all immigrants. Listen.
Raise your hand if your government plan would provide coverage for undocumented immigrants.
We do ourselves no favors by having 11 million undocumented people in our country be unable to access health care.
You cannot let people who are sick, no matter where they come from, no matter what their status, go uncovered. You can't do that.
When I say all, I also mean the undocumented in this country.
Let me just be very clear about this. I am opposed to any policy that would deny in our country any human being from access to public safety, public education, or public health, period.
Now, that's a debate to have, right? It's a worthwhile debate, should they have access to health care or not. But whatever you think of that, whatever you think of what the Democrats on that stage thought or desire, that position is actually not in this current proposal.